The articulated bony pelvis is located between the L5 vertebra and the femur. In the standing position, it transmits the weight from the trunk to the lower limb. In the seated position, the articulated pelvis directly transfers the trunk weight to the ground through the ischial tuberosities. The articulated pelvis is a composite of 3 bones: the innominate, sacrum, and the coccyx. The sacroiliac joint and the pubic symphysis are its joint components. The sacrotuberous and sacrospinous ligaments complete the articulated arrangement. The male urethra is a conducting duct of urine and semen. It begins at the internal urethral orifice, then courses successfully through the prostate gland, urogenital diaphragm, membranous urethra, superficial perineal space, bulbar urethra, and the penis, penile urethra. It ends at the tip of the penis at the external urethral aperture. It is divided into anterior and posterior parts. The prostatic and the membranous urethra together form the posterior. A sagittal section of the male pelvis shows the pelvic viscera in the perineal and anal regions. The pubic symphysis and the sacrum with coccyx can be appreciated in front and behind. The urinary bladder is immediately behind the pubic symphysis. The urethra runs downwards from this organ to the anterior apex of the perineum. The penis and scrotum are seen in the anterior part of the perineum. The female pelvic viscera are located in the pelvic basin formed by the 2 innominate bones and the sacrum. It is demarcated into a true and false pelvis by the inlet to the pelvis. The pubic symphysis is seen in the midline in front. The mons pubis is a mound of skin and connective tissue in front of it. The urinary bladder is immediately behind the pubic symphysis. The sagittal section of the female pelvis shows the pelvic viscera in situ, the adjacent bones, the perineal and anal regions. The pubic symphysis and the sacrum with coccyx can be appreciated in front and behind. The urinary bladder is immediately behind the pubic symphysis. The urethra runs downwards from this organ to the anterior apex of the perineum. The uterus is behind the urinary bladder and is partly separated from it by the uterovesical pouch. The fundus, body, and cervix of the uterus can be appreciated along with the vagina. The pelvic diaphragm is a large muscular basin in the lower pelvis. It separates the cavity of the pelvis from the superficial perineal space and the anal regions. It is almost entirely composed of the levator ani muscle. This muscle has 3 parts: pubic, iliac, and ischial. Fibers arise from both sides of the pelvic wall and converge in the midline. In addition to intermixing in the midline, the fibers also encircle local viscera: urethra, vagina, anal canal. The abdominal aorta is accompanied by the IVC as it descends on the posterior abdominal wall. At L4-L5 junction, it divides into 2 common iliac arteries. Each common iliac artery runs inferolaterally to the front of the sacroiliac joint. Here it divides into internal and external iliac arteries. The external iliac artery exits the pelvis to supply the entire lower limb. The rectum is the terminal part of the digestive tract. It is a dilated vertical tube located in the posterior part of the pelvic cavity. It ends in the anal canal where the sphincteric mechanisms guard the outflow of undigested food material. The rectum is immediately anterior to the sacrum and follows its concavity. It is covered by peritoneum in its upper third and partly in its middle third. The urinary bladder is in front of it in males. The perineum is a diamond-shaped area in the floor of the trunk. It is best appreciated in the lithotomy position. Its anterior angle is the symphysis pubis, while the posterior angle is the tip of the coccyx. The ischial tuberosities form the two lateral angles. The ischiopubic rami form the anterolateral boundary. A line joining the ischial tuberosities to the tip of the coccyx forms the posterolateral boundary. It is divided into two triangles, an anterior urogenital triangle. The superficial perineal space is a triangular surgical space in the male urogenital triangle. Its roof is the perineal membrane, and its floor is the skin and superficial fascia. It is bounded laterally by the ischiopubic rami, while posteriorly it is sealed by the perineal body, where it merges with the perineal membrane. Anteriorly it is limited by the symphysis pubis. The spongy part of the urethra, bulb of the penis, corpus spongiosum and corpora cavernosa are the principal contents. Superficial perineal pouch, female. The perineum is divided into two triangles, the anterior urogenital triangle and the posterior anal triangle. The urogenital triangle has two spaces, the superficial and the deep perineal space. The superficial perineal space is a triangular pouch located below the urogenital diaphragm. It is bounded by the ischiopubic rami on either sides and the pubic symphysis in front. A line joining the two ischial tuberosities forms the posterior border. In the middle of this border lies the perineal body. The roof is formed by the inferior fascia of the urogenital diaphragm, also called the perineal membrane. The urogenital triangle is sandwiched between the pelvic cavity and the superficial perineal space. It is bounded by the superior fascia above and the perineal membrane below. Both the fasciae are fused posteriorly at the perineal body. It is limited anteriorly by the pubic symphysis and pubic bone, and laterally by the ischiopubic rami. The urethra pierces it in both sexes, while the vagina passes through it in the female. The penis is the male copulatory organ. It is designed to enable the passage of urine and semen. Like the scrotum, it is located outside the pelvic cavity. The penis is made of two large masses of erectile tissue called the corpora cavernosa. These are wrapped by fibrous tissue and lodged adjacent to each other. Traced posteriorly, the corpora separate as the crura, which are attached to the ischiopubic ramus. The scrotum is a crumpled skin sac that lodges the testis and epididymis outside the peritoneal cavity. It hangs like a pendular pouch between the upper thighs and behind the penis. A midline sagittal raphe runs through its ventral surface. Deep to it is a scrotal septum. On either side are the right and left compartments for the testis and epididymis of the corresponding side. The testis is the male gonadal organ. The female urethra is a short muscular tube connecting the bladder to the exterior. It runs from the bladder neck superiorly to the vestibule inferiorly. The pubic symphysis is in front of it. The anterior vaginal wall is behind it all through its course. At its beginning, it is surrounded by smooth muscle which forms the internal urethral sphincter. The external urethral sphincter is formed by skeletal muscle of the urogenital diaphragm. The male urethra is a conducting duct of urine and semen. It begins at the internal urethral orifice, then courses successfully through the prostate gland, urogenital diaphragm, membranous urethra, superficial perineal space, bulbar urethra, and the penis, penile urethra. It ends at the tip of the penis at the external urethral aperture. It is divided into anterior and posterior parts. The prostatic and the membranous urethra together form the posterior part. The bulbar and penile urethra form the anterior part.